If you're over 50, your bowels might be trying to tell you something serious. And most people ignore it until it's too late. Constipation, leaking, or sudden changes in bowel habits are not just embarrassing, they're warning signals that something deeper could be wrong. In this video, I'll explain what those signs mean, what's happening inside your body, and what you can do right now before it becomes a major problem. Your bowel movements are like a daily health report card that most people completely ignore. But when things start going wrong with leaking or severe constipation, your body is essentially waving red flags trying to get your attention. These aren't just minor inconveniences you should push through or feel embarrassed about. They're potential indicators of serious underlying conditions that require immediate attention. Subscribe to the channel so we can benefit you by creating more great content with you in mind. And as a thank you, download your free guide from the link in the description below. Let's start with the leaking issue, medically known as fecal incontinence. This affects millions of people worldwide, yet it remains one of the most under-discussed health problems because of the stigma attached to it. When you experience unexpected bowel leakage, several different mechanisms could be at play. Your anal sphincter muscles, which normally keep everything sealed tight, might be damaged or weakened. This can happen due to childbirth injuries, previous surgeries, or simply aging. The nerves that control these muscles could also be compromised, making it impossible for your brain to properly communicate with your bowel control system. But here's where things get really concerning. Chronic leaking combined with constipation often points to a condition called overflow incontinence. Picture this scenario. You're severely constipated with a large mass of hardened stool blocking your colon. Your body can't push this blockage out normally, so liquid stool starts seeping around the edges. You end up with the worst of both worlds. You're constipated and leaking simultaneously. This creates a vicious cycle where the problem just keeps getting worse. Now let's talk about constipation as an isolated symptom. Most people think constipation just means you're not eating enough fiber or drinking enough water. While those factors definitely play a role, chronic constipation can signal much more serious underlying conditions. We're talking about inflammatory bowel diseases, like Crohn's disease or ulcerative colitis. These autoimmune conditions cause your immune system to attack your own digestive tract, leading to inflammation, scarring, and disrupted bowel function. Irritable bowel syndrome, commonly called IBS, represents another major culprit behind these symptoms. IBS affects the communication between your brain and gut, causing unpredictable changes in bowel habits. One day you might be severely constipated, the next you could be dealing with urgency and leaking. The condition creates a hypersensitive gut that overreacts to normal stimuli like stress, certain foods, or hormonal changes. Here's something that might shock you. Neurological conditions can also manifest through bowel problems. Multiple sclerosis, Parkinson's disease, spinal cord injuries, and even diabetes can all interfere with the complex nerve pathways that control your digestive system. Your brain needs to coordinate with your spinal cord, which then communicates with the muscles and organs in your abdomen. When any part of this network gets disrupted, bowel control becomes compromised. Pelvic floor dysfunction represents another piece of this puzzle that many people have never heard of. Your pelvic floor consists of a hammock of muscles that support all your pelvic organs, including your bowel and bladder. When these muscles become too tight, too weak, or poorly coordinated, they can't properly support normal bowel function. Women who've had multiple pregnancies or difficult deliveries are particularly susceptible, but men can develop pelvic floor problems too, especially after prostate surgery. Let's dive deeper into some of the more serious conditions these symptoms might indicate. Colorectal cancer, while not the most common cause, absolutely cannot be ignored when you're experiencing persistent bowel changes. Cancer in your colon or rectum can create blockages that lead to constipation, while tumors can also damage the muscles and nerves responsible for continence. The combination of these symptoms, especially when accompanied by blood and stool, unexplained weight loss, or persistent abdominal pain, demands immediate medical evaluation. Inflammatory conditions extend beyond just IBS and IBD. Diverticulitis, where small pouches in your colon become infected and inflamed, can cause significant bowel dysfunction. These pouches, called diverticula, develop over time as weak spots in your colon wall balloon outward. When they become infected, the resulting inflammation can severely disrupt normal bowel patterns and potentially lead to complications like abscesses or perforations. Medication side effects represent a frequently overlooked cause of bowel problems. Opioid pain medications are notorious for causing severe constipation by slowing down gut motility. Antidepressants, particularly tricyclics, can have similar effects. Iron supplements, calcium channel blockers for blood pressure, and even some antacids can contribute to constipation. On the flip side, certain medications can cause diarrhea and urgency that might lead to incontinence episodes. Hormonal imbalances also play a significant role in bowel function. Thyroid disorders, whether overactive or underactive, can dramatically affect your digestive system. An underactive thyroid slows everything down, leading to severe constipation, while an overactive thyroid can cause diarrhea and urgency. Women going through menopause often experience changes in bowel habits due to fluctuating estrogen levels, which affect gut motility and the pelvic floor muscles. The psychological component of bowel problems cannot be understated. Chronic stress, anxiety, and depression all have direct impacts on gut function through the gut-brain axis. This bidirectional communication highway means that mental health issues can cause physical digestive symptoms, while digestive problems can worsen mental health. It's a complex interplay that requires addressing both the physical and psychological aspects of the condition. Dietary factors extend far beyond simple fiber intake. Food intolerances and allergies can create chronic inflammation in your digestive tract, leading to unpredictable bowel habits. Lactose intolerance, gluten sensitivity, and FODMAP sensitivities can all contribute to alternating constipation and diarrhea patterns. Even artificial sweeteners, particularly sorbitol and other sugar alcohols, can cause digestive upset in sensitive individuals. Structural abnormalities in your digestive tract might also be responsible for these symptoms. Strictures, which are narrowed sections of bowel due to scarring or inflammation, can cause partial blockages that lead to constipation and overflow incontinence. Rectal prolapse, where part of your rectum slides out of position, can interfere with normal bowel control mechanisms. Age-related changes in your digestive system naturally affect bowel function. As you get older, the muscles throughout your digestive tract become weaker and less coordinated. The anal sphincter muscles lose some of their strength and responsiveness. Nerve function can decline, making it harder for your brain to sense when you need to have a bowel movement or to control the timing appropriately. So, what should you do if you're experiencing these symptoms? First and foremost, don't suffer in silence or assume these problems will resolve on their own. Document your symptoms carefully, including their frequency, severity, and any potential triggers you notice. Keep a bowel diary that tracks your eating patterns, stress levels, medications, and bowel movements. Schedule an appointment with your healthcare provider immediately, especially if you're experiencing sudden changes in bowel habits, blood in your stool, severe abdominal pain, or unexplained weight loss. Be completely honest about your symptoms, even though it might feel embarrassing. Your doctor has heard it all before and needs accurate information to help you properly. Depending on your symptoms and medical history, your doctor might recommend various tests, including blood work to check for inflammatory markers, stool samples to rule out infections, colonoscopy to visualize your colon directly, or specialized tests like anorectal manometry to assess muscle function. Treatment options vary widely depending on the underlying cause, but might include dietary modifications, medications to regulate bowel function, pelvic floor physical therapy, biofeedback training, or in some cases, surgical interventions. Remember, these symptoms are your body's way of communicating that something needs attention. Don't ignore these important warning signs or let embarrassment prevent you from seeking the help you need. Your digestive health directly impacts your overall quality of life, and effective treatments are available for most conditions causing these problems. Take action today because your health and well-being depend on it.